All right, everybody, this is the first clinic of 2026, and we are joined by Dr. Kathryn Sharbrough of Charleston Equine Clinic. She's been our veterinarian here at Low Country Acres for several years now. And speaking of Burley Brian, she was his vet when he was born here, and now he's living his best life in Oklahoma. Anyway, she's got lots of experience, and one of her favorite things to do is equine reproduction, but she's going to dive into that. And so we're real thankful to have her time today. Let's get started. Doc.
All right. So, kind of brief overview. We're going to start with just kind of mare management. Quick overview of just what I mean, kind of some issues that can come up there, kind of how mares mature. And then big thing would be like the breeding soundness exam. That's really important, whether you're purchasing a mare, and then even just, trying to get her ready for the season. Kind of go over kind of the parts of the cycle, drugs we'll use, things like that. Then we're going to delve into the different types of breeding and the pros and cons of each of those. And then also some issues that might come up while you're trying to get your mare pregnant. So just kind of quick review on anatomy. Um, the vagina is long, it's a muscular organ, all the way from the vulva to the cervix. Um, you've got three different parts that are really important. One of them is going to be this vulvovaginal sphincter, and that's associated with folds of tissue that kind of cover the urethral opening. And this helps to prevent urine flow back towards the cervix. Um, you've also got the posterior vagina, the vestibule, and then the anterior vagina, which is closer to the cervix. Um, so again, you've got your external part with your the vulvar lips, the vulvovaginal sphincter, and then of course your cervix, and kind of those three things are going to help really prevent infection in a mare. So if you've got poor conformation starting externally, it is going to predispose your mare for complications, such as infection. So all of, just those kind of simple things there can make a huge difference. Don't forget if you've got a young mare, some of them will have essentially a hymen. It's just a thin layer of connective tissue. Um, when you're going in to breed a mare for the first time, the stallion's covering the mare. There might be a little bit of blood when that is broken, and it can be a little uncomfortable for them as well. So just have to be careful um, with that in these young mares, and like I said, not abnormal for that to be there. Um, oh,
Down there.
down.
We're not. Hold on a second. There we go.
What's- Um, And then, so you've got your cervix, which is a thick-walled muscular organ, usually about 5 to 7 inches. And that is what's gonna, be the biggest protector of the uterus, especially once the mare is pregnant. So this is also gonna help kind of any sperm that's not good quality, kind of prevent it from um, getting further up. And then it's also going to help keep the sperm that are viable in the uterus where they need to be to establish a pregnancy. Um, you've got two uterine horns, and they do roughly form kind of a T shape in the mare. And so again, the uterus or the embryo is going to kind of move freely between both horns and the body to establish kind of recognition of pregnancy. We use the cervix a good bit. You can actually look at it via speculum to kind of help determine where the mare is in her cycle. So it's gonna be nice and relaxed when she's in heat, and essentially we call it high and tight when she's either pregnant or in diestrus. And then it does produce a thin mucus, and also t the quality of that mucus produced can give us some information too, again, as to where she is in her cycle. Um, don't use it quite as much as we used to, just since we do have ultrasound available now. We probably don't do, we aren't looking at the cervix as much as we used to, but definitely it's still a very important part, of our kind of exam. And definitely they can have issues, you know, um, as they get older, or if they have injuries during parturition that can affect how well that cervix opens or closes. So, very important part of kind of the anatomy. Again, during diastrus, it's tightly contracted, and there's some thick mucus, especially during pregnancy, that's going to help kind of seal the uterus off. And then, like I said earlier, if they're in heat, it's a little bit more kind of watery. Um, Most common barrier that tends to be a problem is just the vulva, whether it's the lips are a little too loose. Most commonly, we see it where the mare has kind of what we call a tilted anatomy. So the anus is a little sunken compared to the vulva lips. And we'll, depending on how much of the vulva is kind of below the floor of the pelvis there, we will consider suturing the top part of the vulva shut. And the idea behind that is that so the lips are loose, they can suck air, which can be mildly uncomfortable. And then it also just creates inflammation, as well as anytime the mare passes some manure, there's the chance that a little bit of kind of fecal matter or fecal fluid can kind of seep through there, in which case any of those bacteria can move further up into the reproductive tract. So to do that, we'll either cut open or take a small piece of either side of the vulvar lips, sew that together, and essentially it'll scar down. And then the big thing to remember is if you ever do this with your mare, and she is pregnant, we always want to make sure that that gets taken out well before, usually about 30 days before they are due to foal. But like I said, again, we're doing this to help prevent infection, or if the mare has had an infection before, we'll do it kind of preventatively. Again, trying to make sure we don't get an endometritis, we don't get any kind of placentitis, um, and uh, and then, like I said, we'll take it out. That's the biggest thing to remember, is that it has to come out. Otherwise, they can have a lot of foaling trauma.
Is there any, before we move on to the next segment, any questions regarding uh,
Like
anatomy?
anatomy.
Okay, we'll move on to sexual maturation. Yeah, go ahead.
All right. Draft mares do tend to mature a little bit slower. Not terribly surprising, but usually they will start cycling anywhere from between 12 to 24 months. So if you have foals that are together, especially if you've got, fillies and colts, make sure you're starting to separate them at this stage. People always say, oh, they're not doing it. Trust me, they are. You're just not seeing it. And you definitely don't want your filly to be getting pregnant at that age. 3 to 5 is kind of typically when we will start breeding mares. Don't forget though, your draft mares, they can grow, you know, 4 to 5 before they're fully grown. I'd say even maybe a little bit for some of them, even upwards of 6, before they're really filled out and fully mature. So also kind of know your mares a little bit. When we breed them younger, or if we breed them a little bit too soon, then it will actually slow down their growth. So they're putting all that nutrition into the baby and not themselves. So they won't get quite as maybe tall if you're trying to breed them at, 2, or even if you at 3, we're breeding them at 3. Some of them, like I said, if they haven't kind of matured, you might want to wait a year. So definitely something to talk about with your vet to make sure, hey, are we ready to go ahead and start breeding her? 4 to 15, definitely prime reproductive years for these mares. Um, I would say though, if you're getting past 15 to start breeding, kind of waiting a little long, you do start getting problems if we start waiting till after that. So really that kind of peak time between 6 and 7, I really like mares to be bred before 10. Um, so somewhere in there is a great time to start breeding them. Fertility is really high at that age too. They're healthy. Um, their risks of other issues kind of contributing to fertility are much lower at that stage too. Once you get over 15, we definitely start seeing just fertility issues. You have a lot more pregnancy loss, whether it's early on in the pregnancy or even later. And then definitely upwards of the 20s, definitely a lot more assistance is needed um, for various reasons. Um, and then hard to know for sure because we tend to not be ultrasounding mares in their mid 20s and up, but eventually they have the potential to quit cycling. Um, Embryo quality decreases pretty significantly once you get over 20, um, as well as just all the other changes that can happen. So, like I said, somewhere between that kind of 3 to 10 years is probably a good time to be trying to breed your mare. Um, so, and then breeding soundness exams. This is probably what y'all are doing the most of. Very, very important if you're doing a pre-purchase on a mare, even if you aren't sure if you're going to breed her, if there's even a potential that you would have that done. I unfortunately see a lot of mares that people get and they don't get that done, and then all they want to breed. And unfortunately, it just is a kind of bit of a nightmare trying to explain to them why that mare won't ever carry a foal or isn't a good candidate. So it's definitely worth it to have that done. Um, Definitely before each breeding season, especially if you have a mare who kind of bred the season before, whatever reason, just never got her pregnant, or she got pregnant and lost one. Definitely want to do a breeding soundness on her to kind of know what we can do differently. Um, and then two, potentially after foaling, especially if there were any issues with the foaling, it would be good to do a breeding soundness as well. I will say if the foaling was rather uneventful, everything went normally, breeding her the year before was normal, you may not need to do a full breeding soundness on her at that point. Um, but and so what are, as a vet, what am I kind of coming and doing when we're doing those? Definitely you want to know just overall history of the mare and then a good physical, especially for some of these slightly older mares, if they have any kind of lameness issues. Definitely kind of chronic pain can can influence or can affect some pregnancies at times. So, we want to just make sure overall they're in good health. Um, Overall, again, history, nothing's really changed. Um, we want to do just a good external exam. Again, making sure we don't have any poor conformation that we need to, hey, do we need to put a caslick in this mare? Is there, kind of, are we pooling urine? Things like that is what we're going to be looking for. And then we're going to do a rectal exam where we palpate uterus, ovaries, and then an ultrasound too. You know, sometime even just the palpation, especially if the mare's had multiple foals, that uterus can start to kind of hang over the brim of the pelvis, predispose her to kind of retaining fluids. So even just a palpation can help give us clues as to maybe why the mare is having trouble getting pregnant. Um, and then our uterine culture, cytology, and biopsy, which are all very, very important too. Um, the biopsy, I don't do every time. I think that's kind of on an as needed basis, depending on what we're doing, but definitely the uterine culture and cytology, you always want to do those two together. Um, so again, we're going to do these because every time we go in, say we're AIing, every time the mare is bred, you know, there is risk for carrying bacteria in there. It's when we're AIing, it's not a sterile procedure, it's a clean procedure. So there's always the chance that we can take an organism with us. Same thing with the stallion. You know, even if you're doing in-hand covering, you wash the mare up, there's still the potential that they're taking in bacteria that then can cause a infection. So we use the culture and cytology. Similar, ideally the cytology, I like to use a brush, and then the culture we're using a swab, and typically, I think most vets these days are going to be using like the double guarded, um, and that definitely would be the way to go because that's going to decrease your risk for contamination. And then the cytology brush, we put that on a slide, and look at that, and the culture we take that swab and then grow it on a plate and usually see some results within about 24, 48 hours. Not as common, but they do happen. You can get some fungal growth. Those take, unfortunately, quite a bit longer to culture. So 2, even sometimes 4 weeks for the fungal cultures to come back. One of the most common bacteria we see is strep zoo. Definitely we can have a lot, you know, there's definitely Pseudomonas, Enterobacter. So there are unfortunately quite a few different types of bacteria, but definitely the strep zooepidemicus is probably one of our more common causes of endometritis that we see. Again, kind of the different parts of the soundness exam. Like I said, the endometrial cytology, that one is really important. We're looking at the different cell types. You know, do we see a lot of neutrophils? You can even see bacteria, and if so, what type? The cytology is nice because we use that, and then based on that, we might start kind of treatment, especially if we do see bacteria on that cytology. Kind of while we're waiting for our culture results. And you can also, we also would do the low volume uterine lavage. And this is a little bit more advanced. So this would be something I would definitely use on like a mare who we bred the year before, just couldn't ever get her pregnant, or one that lost a pregnancy. The idea with it is that you're gonna be you put a little bit of saline in and then we you know, draw it back out. And the idea is you get a more representative sample of what is going on in the uterus. It also can kind of get in all the little crevices in the uterus as well, and so hopefully can catch some bacteria. Not all the bacteria are just on kind of that top layer of the uterus, so kind of having the fluid get in there and get in all the nooks and crannies. Like I said, sometimes you can catch some bacteria that otherwise you wouldn't with just doing the swab. And so then we spin that sample down and submit that for culture. And then the biopsy, that one is really important. Again, if you're purchasing a mare for breeding, if you're trying to figure out can this mare even carry a foal? So say she's lost, like gotten pregnant, but then lost a couple foals. Um, the biopsy is going to really give you that prognosis of her ability to carry a foal to term. The other thing it can help you with too is sometimes, again, you're having like you're convinced there's an infection, but you just for whatever reason haven't been able to grow it on a culture, or just you grow one, you treat it, but the mare still seems to be, carrying an infection. This is where a biopsy could be helpful too. Again, when the uterus is under the effects of all the estrogen when they're in heat, the bacteria can get in there pretty deep. And so sometimes that biopsy can show us a little bit better where the bacteria are in the uterus. Are they kind of hiding deeper? Are they more superficial in there? Um, and then too, just the chronic changes that can come with repeated infections. Um, so it does take quite a bit longer to get back. Again, you can actually take biopsy samples and then culture those as well. But you have to remember that culture is then only coming from that one spot in the uterus. But it is, it can be helpful there. Um, and it, is a little bit more costly because you have the sampling as well as then it gets sent off to the pathologist for them to look at. Um, Again, so one of the major causes of infertility is just endometrial fibrosis. And a lot of that is just due to, chronic inflammation. Um, some mares just are a little bit more prone to it than others for kind of multitude of reasons. One thing we can do to help is definitely use some DMSO. I use it a good bit. The other thing too we'll use is there are lots of different agents as well. A lot of these bacteria that we're dealing with these days create a biofilm. And so DMSO can help to kind of clear that biofilm. There are some other things such as like tris-EDTA that we can use as well. And what that biofilm does is this essentially protects the bacteria, and so you can put all the antibiotics in the world in, but they're not going to even be able to touch the bacteria because they're, again, protected with this film. So you've got to break that up using things such as like DMSO, the tris-EDTA, and then you can use your antibiotics. So, and then kind of like this, it's, the endometrium returns to normal by about day 21 after the infusions. Um, So ideally, we're not, if they have an infection, we're trying to, they have a lot of inflammation. We want to really treat that before we breed them. I have had owners that want to try and do both at the same time. I wouldn't recommend it. Get that uterus cleaned up first, and then you can follow up before you, like I said, just before you try and actually get them pregnant. Um, and we call, the mares clean or dirty. So dirty mares are definitely ones that have had kind of repeated uterine infections. If they have for some reason an acute infectious endometritis, mares that are have the persistent mating induced endometritis. Um, and these you definitely, if they have this history. We want to check them. I like to check them sooner, if at all possible, as early as 4 hours after they've been bred, because you can go in there and you can start flushing that uterus 4 hours, after either live cover, AI. and go ahead and start cleaning kind of all that excess um, out. And that is going to be one of the biggest things that's going to help you decrease um, kind of the post-breeding endometritis. Um,
Do we want to pause it?
yeah,
Does anybody have any
say
questions uh, so far about treatments and cytology,
the different.
I
pathology?
threw one in the chat box. I don't know if it came through, but how much fluid are you using on those low volume lavages when you're going to culture the fluid return?
It's just a few hundred mils.
Okay.
So it's not much. So, usually about 200, 250 mils. I might do just a little bit more if it's a like post foaling mare, just because, uterus might is going to be just a little bit bigger, but
Sure.
usually within 30 days though, that uterus is involuted enough. Um,
Right.
but if they've had multiple foals, I do put in a little bit more for them, but usually about 250 mils, so not much, but
Okay. Thanks.
Mhm.
That's all we have.
Big thing to remember is, or to that I think is very confusing. I have to explain this a lot. So you can often have a positive culture and a positive cytology. If you have those, and you have signs, fluid in the uterus when you shouldn't have it, that is definitely correlated with you have an infection you need to treat. Your chance of getting that mare pregnant, I will say, isn't impossible, but it is low, very low. Um, so, 10 to 20%. Um, you can have a positive culture and a negative cytology. With that, I usually am concerned that somehow we got a, oh gosh, a contaminant if I have a negative cytology. And when you say negative, like no inflammatory cells, no signs of bacteria, kind of normal distribution of just normal uterine cells. Um, but even with that, you still again can have a positive outcome. If you have a negative culture and a negative cytology, which is ideally what you want before you're trying to breed, then you're looking anywhere from that 60 to 70% realistically of getting a pregnancy, which is again, that's fairly standard average for especially AI. And then of course, lots of other variables come into play, stallion fertility, timing of breeding. Um, so, but like I said, and then you can have a positive cytology and a negative culture. Um, when I see those, if we did just the kind of swab for the culture with those, I want to go back and I'll do the low volume lavage on those because if I have a positive cytology, there is an infection. There's usually inflammation. And just to completely rule out that there isn't an infection is why I will go back with the low volume lavage and just completely rule that out before we try and breed this mare. Um, and then again with
There's a question. Should the stallion owners require clean culture cytology pre-breeding in the contracts for stallion owners?
um should they? I mean, I don't know. I think it's good for them. I think they're doing it more to cover um because that really comes back to probably then kind of their numbers as far as the numbers a lot of them will try and get out are going to be, how many mares did the stallion get pregnant, especially the first round? Um, overall, how many was he able to get pregnant? So I think in that regard, they're trying to increase their chances that the stallion, that it's going to end up with a positive outcome. And realistically, if you're spending the money even for in-hand cover, um, you want to make sure everyone has the best odds that this is going to establish a pregnancy. So I think it is a good practice that they are doing. Um, but
I guess it would be preference.
yeah, I
Yeah.
mean, I think it's preference, but I don't know that like they have to. But I think again, I think it's trying to ensure that mare owners are happy, stallion owners are, you know, again, that you're getting the best odds of establishing a pregnancy sooner. Every time you have to ship, you're paying money for the shipping of the semen. Um, so if we can, and why ship semen or why collect a stallion on a mare that has an infection?
Hmm.
You're kind of, I won't say completely wasting time, but it is a lot of resources that would be better to wait until the mare is clean.
Hmm.
So definitely if you're doing in-hand breeding, yes, for sure, just because you don't want to transmit anything. Um, so, but even for AI, I think it is very helpful.
Which we're going to cover sexually transmitted diseases in part two,
Yeah,
stallion
the
management.
stallions, yeah.
Yeah.
So breeding soundness exams start, I mean, I truthfully feel like 200 might be a little on the low side even. And that includes your standard exam, so your general overall external physical exam, and then the palpation, ultrasound, cytology, and culture. Um, every vet probably is a little different, but I do sedate most all my mares. Again, it kind of depends, so that also factor in some sedation too, potentially. And that is kind of a safety thing for both the mare as well as even the owner's holding, as well as the vet for sure. So it all depends on, do you have stocks available? Is your mare used to this? Is she well behaved? Um, so, and then uterine treatments. So for the culture, cytology, potentially the low volume lavage, the biopsy, those all I would say probably are going to be in that 350 to 500. When we start talking about needing to treat a mare for an infection, easily you're upwards of $1,000. I feel like that's a pretty average estimate for that. So it can get pretty expensive pretty quickly. But again, think of everything that's going into, how much are you paying for the stallion fee? Like to make sure that again, the odds are better for both the stallion and the mare. It's worth doing the culture and the biopsy and the cytology. Any questions? Make sure before we
I think we're good so far.
kind of switch gears just a little.
Yeah.
So just to kind of review, or we're going to kind of touch into the hormone aspect of it all. So mares are considered seasonally polyestrous. So they typically cycle kind of late spring, summer, and early fall, and not during the winter. That being said, every year there is about 25% of mares that will cycle year round. So it's not impossible for them to cycle through the winter. And just because they do one year doesn't mean they will the next. And exactly why they cycle through the winter, that part is getting a little into, we're talking about hormones. There's not no way to predict them all. So, and it is interesting. We were talking earlier. It seems like there are a lot of mares that are cycling right now. Not sure what to think of that, but we will see, I guess, this next breeding season what happens. But so you've got estrus, which is just the entire cycle. Probably what you're going to hear more is estrus, and that's the heat part, or when your mare is actively in heat, when they're actually ready to be bred and receptive to the stallion. You have the diestrus, and that's the part where she's not, or she's not in heat. And that, again, like I said, they're not receptive, they're not cycling. And then you have anestrus, which is typically when they are doing absolutely, there's little to no activity on the ovaries. And typically we see this during the winter time. So the estrus cycle roughly lasts about 21 days on average, with the heat part or the estrus part being when she's receptive, which is usually 5 to 7 days. And then ovulation usually occurs to the end of that. So again, you've got the heat cycle, which lasts about 5 to 7 days. About 24 to 48 hours before the end of that is when she's actually going to ovulate. So they'll ovulate, they'll still act like, still be showing the signs of being in heat, still be willing to be bred, receptive to the stallion. And then they enter diestrus, and that'll last about 14 to 16 days. At that point, if there's no embryo, the mare wasn't bred, then they're going to release some hormones, which will cause the regression of the CL, and then this will bring them essentially back into heat. Kind of the cycle starts all over again. The cycle can be a little bit longer, or like say, February, March, when they're just starting to come in heat. And then towards the end of summer, so you're getting like August, September, that cycle actually can even shorten down to like 19 days. So, in which part the estrus part tends to be closer to that 5 days. So, they're trying to, as the end of summer, fall comes around, they're coming in heat just a little bit more frequently. Just try and, think of them in the wild. They're just trying to get pregnant, pass pass all those genes along to the next generation. And then typically the day that the mare goes out of heat is kind of considered their cycle. Or if you know exactly when they ovulate, that would be the other way we kind of estimate their cycle. And then you can also use this because if they're cycling more frequently than roughly every 3 weeks, say they're coming into heat and you feel like it's every 2 weeks, that actually can be indicative of some problems. So typically then I start thinking they have an infection, and they are essentially short cycling themselves. Or if they seem like they're just never in heat. Some mares every now and then will have what's called a diestral follicle, and they will actually cycle in diestrus. And so they do almost seem to never come into heat because there's always a pretty high level of progesterone. So those mares, both of those can kind of give you some indications that need further looking into, to see what's going on. So, and this is kind of getting into the hormones, but this is where, again, a lot of our drugs come into play. We're trying to manipulate these. So your estrogen, that's what, causes a lot of those signs of the mare being in heat, the mare being marish. And this will peak as she gets closer to ovulation. The progesterone, that's what's going to be.
So Olga asked, just cutting in here really quick.
Yeah.
We noticed that our mares who are housed together synchronize cycles. Is this generally common in the broodmare herds?
It does seem to be, for sure. You'll have groups of them, especially too, I think the more of a herd they actually are, then yes. But we'll definitely see that, even in a clinic setting, that it seems like they will kind of group together. So yes, that is definitely possible. Um, which can be good and bad too.
Well, I think in Rebecca's case, when her whole herd's in season during the winter, that would be terrible. Yeah.
But um so the progesterone that's produced by the CL or the corpus luteum, and that's what's going to either maintain your early pregnancy, or kind of maintain them not showing signs of heat. Um, the testosterone that is produced, by the ovaries, and this can contribute to sometimes some of the aggressive behavior you see. Um, Also, too, I don't think we get into this too much, really, but definitely if your mare is acting almost studdish, or more aggressive than normal, then we start looking at potential like ovarian tumors, which thankfully don't happen very commonly. But then we'd be checking kind of these hormone levels. Um, so your GnRH, your gonadotropin releasing hormone, is produced by the hypothalamus. This is the one that then is going to stimulate, the two main ones that are kind of in control of the cycle, your FSH, or your follicle stimulating hormone, or your LH, the luteinizing hormone. And then we've got, our prostaglandins, and that's from the uterus, when they don't, if there's no embryo present. Um, and so that is what's going to kind of cause, if they don't recognize a pregnancy, cause the mare to come back into heat. So,
But if a mare is pregnant, they'll produce progesterone the
yes,
until the uterus takes over. Is that correct?
correct. But that's going to be quite a few months before the, uterus is going to take over production of that.
Okay. One question from Olga.
Yeah.
What if we have a mare acting like a stallion only while pregnant? I have one of those, actually.
Yeah. Um, I mean, some of that too is kind of again, yeah, I mean, definitely during the pregnancy, they can definitely produce a little bit more testosterone. Um, I would also wonder, like, was the mare sexed? Did y'all have the fetus sexed?
Olga, feel free to weigh in over audio.
Uh, no, we did not have the
The
full
fetus.
sext, so
Yeah,
we don't know if it's a boy or a girl. But
yeah,
this mare had a lot of symptoms throughout the pregnancy. We're interested to see what it's going to end up being.
yeah,
I will say the mare that I have trouble with,
actually,
she's the one you sexed at
yeah.
having a colt. So
And
that's
I
interesting.
was gonna say too, like, I have actually had mares, that have had a foal on their side that then came in, with an ovary that was, for rebreed that had one that was suspicious. And I think we did the hormone, panel on her, and she did end up having, the granulosa cell. So she, thecal tumor. So they can still get those. Um, you know, I don't know, like, percentages or whatnot. That's the only one I've had that was like that. But yeah, I mean, she had a full on her side, and she definitely had a, granulosa thecal cell tumor. So not
Mm.
impossible. So definitely would, but you're gonna find that, could always have her ultrasounded now and see what the ovary looks like. Um, or it could just be kind of hormonal related to, um, potentially the sex of the foal a little bit too.
Yeah, this particular mare gets scanned a lot because she's our difficult mare. She's an older maiden, teenage maiden. So we certainly had a lot of scans, and they did not bring up anything like a tumor. So I'm curious, is it something that's easy to observe on the ovary, or something that you guys specifically look for?
No, it's pretty easy to tell. on ultrasound. So it tends to have kind of a cystic looking appearance. I mean, it looks very different than, like an ovary with just a bunch of follicles. But, um, so I doubt that that's the case. It doesn't sound like that would be what's happening in her case. Um, but how far along is she?
She's 9 months
Okay.
right now. But this, the symptoms of acting like a stallion, they were present early on. I would say for a few months, then it went away and she was doing fine. She loved everybody. Then she, kind of hated everyone again and was acting like a boy again. Now she's talking to the other ladies like a stallion, while she's 9 months. So it kind of, came and
Came and went.
went away and reappeared throughout her pregnancy. So we've heard all kinds of things that it might be a colt, we
Yeah.
heard people say that's not always the case. So
Yeah.
curious to see what we're gonna get.
What happens? Yeah, that is interesting though. Um, that would make me, especially with it kind of coming and going, I would lean a little bit more towards it's just kind of her hormones fluctuating. Um, so, because typically, if it's more tumor related, truthfully, like that's going to come and just like you really, I wouldn't expect to see the fluctuations with that. The mares I've had with those, um, they're consistently stallion-like. It doesn't come and go. So, um, but yeah, it will be interesting to see what sex you end up getting with that foal.
Yeah, we got a little while to go.
Um, so the stages of the estrous cycle, this is important when you're talking about kind of managing, especially managing for breeding. You have your luteal phase, and then your follicular phase. Um, so your luteal phase, is more kind of diestrous. So you've got your corpus luteum, or CL is, definitely I think that's throw that term out a lot. Um, and that at that point they're not receptive, you're not going to be breeding. Um, Again, typically the longer part of the cycle, usually about 14 days. And then the other part, is your follicular phase. So as they start to develop follicles, and they develop quite a few, kind of as the um, kind of buildup of the hormones before they get what's called a dominant follicle, that then they ovulate. And this is also important if you're breeding older mares, um, especially think about your mares that have Cushing's. That does affect their hormones quite a bit. And it definitely plays into this cycle as well. Um, so again, they are long day breeders. So that increase in light goes to the eye. You get a decrease in the melatonin, and that is what's going to help kind of stimulate the production of that gonadotropin releasing hormone. Um, Tell them, hey, let's start cycling. The idea too is, they're breeding while there's the most nutrients available. And again, the weather is most conducive to a foal being born, spring, summer. So optimizing, um, getting pregnant and foaling out at the best time of year for both mare and foal. Um, and then again, your follicle stimulating hormone that's released, and it's going to help initiate the development of the follicle. And again, you kind of have, it's not a steady growth of that, or steady release of that hormone. You get a little release and eventually it builds up until you get that dominant follicle. And that's what's going to produce the estrogen. And that, again, those estrogens help produce all that estrus behavior, the edema that we see in the uterus. Um, oh, and kind of, I don't know if I touched on that, but that's also important. Like the edema. And ideally, you really want to do your culture and cytology when the mare is in heat, just because, again, you can have some bacteria that are more active when there's higher levels of estrogen. And so if you do your culture cytology when the mare, say, is in diestrus, you may not grow those or pick up that. So you can get a negative result, and yet the mare does have an infection. So, sorry for that little sidebar, but yeah, that is kind of an important thing to remember is that ideally you want them to be in heat when you're doing those samplings. Um, and then with that dominant follicle, you actually are going to get a surge in the LH. That's going to cause the actual ovulation. And then again, the progesterone, that's what's either going to maintain the pregnancy, usually until about 120 days of pregnancy, and then the placenta will take over at that point. So, but this is, again, we're going to be, can they see the arrow or no?
Yeah, should be.
So like we're going to be using hormones kind of at this level, definitely different types of progesterones that we'll use. I mean, we're using hormones to kind of help us either get the mare, have her come back into heat, keep her out of heat, help her to ovulate. Um, so follicle size will vary mare to mare. And I'll tell you what, while typically smaller horses, your quarter horses can grow up to like a 32 and ovulate a 32 size follicle. I've even had some ponies that'll get like a size 40 or 45. I actually had one pony that actually got like a 50 millimeter follicle, which I never would have guessed for her. Your draft horses, they tend to get much larger follicles, easily 50 to 60 millimeters, if not even just a little bit bigger sometimes. But it's, that can be helpful, especially when you're doing AI. Sometimes if you say you have a mare that ovulates a little early or a little small, kind of knowing that is helpful for the next cycle. Or if you know you have one that gets really big follicles, if you try and breed them a little bit sooner, then you may not get a pregnancy just because your timing is off. So, knowing kind of what size follicle that mare tends to ovulate is really helpful. And again, while on average your drafts go bigger, some of them, might surprise you and go a little on the smaller side. And then if we're not checking them every day, we use kind of the average, which is that they should grow about 2 to 3 millimeters per day. You can also check too, typically the follicle will stop growing or even regress just a little bit right before they ovulate. And that in conjunction with kind of what the edema is doing in the uterus can be helpful too, because usually there's just a slight reduction in edema right before they ovulate as well. And yeah, so this is a lot of the different drugs that we'll use for, at any point. So we have estromate and lutulise, and those are both analogs of prostaglandin F2 alpha. So we'll use both of those, to try and bring a mare in heat. Definitely if they have some fluid, we're trying to get some uterine contractions, we will use those as well. the estromate, you don't get quite as dramatic of a um, response as Lutalice as far as the kind of side effects. I mean, the Lutalice, we give it in the muscle. Most most all the mares are going to get super sweaty. I even warn owners like some of them will just like looks like they just ran around the pasture for 30 minutes and they're just dripping sweat. Some of them can get even a little mildly crampy with Lutalice. The estromate, like I said, I don't feel like you get quite as many of those side effects, or they're not quite as dramatic. But like I said, both of those can be helpful. Um, and then couple different, there's sucromate, there's desirelin, even HCG, the human gonadotropic releasing hormone, we'll use that. And those we're using those to help induce ovulation. They each have a very slightly different kind of ovulation window based on which one you're using. Sometimes we'll use them together. Like I have done HCG and desirelin before. So it just kind of depends. But most of the time we're using those either if you're, say you're pasture breeding and you want to breed the mare like one time, because she tends to get fluid afterwards. Definitely if you're doing like AI or frozen semen, then we're using those to help time it so that we're putting the semen in at the optimal time. And then you've got Altrinogist or Regimate, and that is our progesterone that we're using to help suppress estrus for whatever reason. We sometimes will use that actually to synchronize mares. There are a couple different protocols, but you can do like a Regimate for 2 weeks, followed by Lutalice. So, I mean, we will use hormone management as well to kind of synchronize either recipient mares or even, say this some of these stallions are on show schedules and they're only available certain times. Um, so the thing to remember is whenever you start dealing with using any of these is sometimes you'll get where they don't respond. You do the desirelin injection, you do those, in theory, yes, they should ovulate within kind of that 48 hours. Sometimes they don't, which is super frustrating for everyone, but that's how it goes. And sometimes it's maybe you were a little early. And again, kind of going back to knowing what size that mare ovulates. So maybe the mare wasn't quite ready to ovulate, and so that's why she didn't respond. Or, you know, sometimes we just don't know, but sometimes they don't respond accordingly. And so, um, it just kind of is a, does happen, I guess I'd say. Um, and then we're using oxytocin quite a bit. Again, we can use it for a lot, definitely for kind of help stimulate uterine contractions, especially post-breeding once we're trying to clear labor, clear fluid. Um, you can use it kind of with parturition. I wouldn't recommend that unless you have a vet or unless there's a reason. Um, and then definitely post-breeding, use it as well. The one thing to remember with that, is that the mares are going to be very, very sensitive to it for the first 24, 48 hours. So like a post-breeding mare, um, we typically are using like a mill and a half maybe, um, in the muscle. If you give that same dose to a mare immediately after foaling, you are going to make her very uncomfortable. So she will get crampy, almost kind of colic-like. So, and again, that has to do with kind of the changes in the hormones, and kind of sensitivity to them. Um, So just make sure if you are doing it post foaling, kind of just talk to your vet and make sure you're um, using a dose that they're comfortable with. Um,
Should we talk? Any questions about?
yeah.
Oh, here we go, Rebecca. What would you recommend for oxytocin dosage for a post-foaling mare?
Yeah, so again, a little tricky, but I would say no more than like a half a mil, even for these big girls. Um, Even sometimes I'll do a quarter, start with a quarter of a mil, at least if I'm talking about just trying to clear fluid. And then I gradually go up from there. So like that first day might do a half a mil, the second day, um, I would use a little bit more. Um, I've had some where I did the half a mil and they would get mildly crampy. So I always at least warn owners. But I personally wouldn't go over a half a mil for like that first 24 hours.
Okay. That's good to know. We use it for if somebody's slow on a placenta, but my vet
Yep.
usually has us doing a CC every hour, so that's good to know that might be a little much.
Well, and I will say that's a little different if they actually do have like a retained placenta, then yeah, I'm doing a little bit different protocol.
Okay.
Because I want that placenta out as soon as possible. So
Yeah,
like
right.
in that case, I don't like if that were the case, yeah, we want them to get a little crampy because they need to pass that because
Okay. Good to know.
I've had too many personally that even once they get past 3 hours, they start getting septic. So I have to admit, if for some reason I have a mare that is still retained at that point, I want to see her. I want to be. I get, I guess, maybe a little aggressive in my
Sure.
treatment. But like I said, I've had mares that have gone septic with, 3.5 hours. So it just,
Okay. Good to know.
yeah, I jump on those pretty quickly and pretty aggressively. But yeah, so in that case, I think using a higher dose is appropriate though.
Okay. Perfect.
But yeah, if you're just trying to clear fluid, because hey, we're gonna breed this mare on full heat, that kind of thing, then, like I said, I would go a little bit lighter just so you don't get, we don't want her to colic, so that's not what we're trying to do or get that uncomfortable.
So Olga also said, we had a client, a mare owner,
Hmm.
whose veterinarian was against using oxytocin post-breeding,
Hmm.
saying it was not good to add more hormones into the mix. We and the majority of our customers use oxy in post-breeding management with good results. Is there any reason to avoid using oxy post-breeding?
Um, I can't really think of any. Um, yeah, I can't think of any reason why I would say no. I mean, I guess the only thing I would say is you want to wait at least 4 hours, but as long as after breeding, um, but as long as it's been 4 hours, then I don't think there are any, I haven't experienced any issues that would that would say no, don't do that.
Okay.
Yeah, um, so we can use the light, the horse's sensitivity to light and to kind of tricking them. Um, so we do this a lot with thoroughbreds, and quarter horses especially because, they're all very concerned with the January 1st birthday. Um, but it still can be helpful too. Say you've got a mare maybe you had some trouble with, and you really want to make sure, hey, let's start working on her early so that way, February, March, so that way, if heaven forbid, it isn't until you've just got a lot longer breeding season to kind of work with that and try and get her pregnant. Um, Sometimes too can even use this for if you kind of want them to foal at a certain time, it can affect gestation length just a little bit. And so we'll use the artificial lighting to kind of trick their body. Um, Typically, we'll Started around December 1st. So I always say right after Thanksgiving, get ready to do this if you want to. And again, by kind of artificially increasing the day length, the light, you decrease that melatonin, which kind of gets that hormone cycle going. Um, they need about 16 hours of total light per day. Don't just go in there and leave the lights on for 24 hours. That actually won't work. So you do have to have the light and the daytime and the nighttime. And you can use timers. Um, you want it so that you can go to the corner of the stall and still read a newspaper. So around 200 watts. Um, and again, the LEDs are good. They're energy efficient, less heat. Um, and then also make sure to close any kind of exterior windows or lights in the aisleway, so that she can't see out into the dark area. One other thing I've liked, I don't know if any of y'all have used them, are those the light masks. So the brand I used a lot was the Equilums. Those are really nice because, of course, hey, you're trying to do this artificial lighting. Now the mare's in the stall for longer periods of time. You've got costs associated with that, with bedding. Potentially the mare's by herself. So they do have these masks available that use a blue light, and that wavelength in one eye, and it's set on a timer. Um, and so it actually it does the same thing. And the nice thing with those is that your mare can be out on the pasture with that on. So she can still be in a group setting potentially, and then you don't have the costs associated with, bedding in the stall, even the energy to, um, light your barn, that kind of thing. So they are a good alternative to consider as well. And, other than unless it's a mare that just won't wear a mask, they look a lot like fly masks, or even if you've ever had a horse with an eye injury, it does have kind of a cup on one side. But like I said, those work pretty well too. Um, and then, so, here we are, we've maybe have done some lighting to get the mare to start cycling early, or hey, we're just breeding during the season. What are we looking for? And can be tricky. Some mares are very showy, very marish, and then some are very, very quiet, and you may not have any idea when your mare's cycling, especially if you don't have, say you don't have a stallion on your property to tease her with. It's can be very hard. So here's just some things you're kind of looking for. Definitely the tail raising, that excessive urination, often in very small amounts. Posturing with their back legs, like this mare is in the picture, kind of rounding that back. Um, they can be for sure distracted, a little more irritable. Some of them are very sensitive to the touch along their back. Um, they can be a little noisier, kind of that squealing, or even kind of aggressive. So all of that can be normal. And again, that kind of their signs are going to vary from mare to mare. Um, so
Any questions before we transition to the breeding coverage? Doesn't look like it.
okay. So what kind of breeding types? We've got lots of options. There's, pasture breeding, which is the very typical kind of way where the mare's just out in the field. You've got the stallion out with either the one mare or even a groups of mares. Definitely advantages, low cost, requires no horse handling. There is a slightly higher or a higher risk of injury to the stallion and the mare. Um, I will say a lot of those stallions do, especially if they've been doing it for a while, do tend to be well behaved and respectful towards the mare, but definitely they are at a high risk still, especially if you have a mare who's never been live covered. Even if they are in heat, they can still, there's always the potential for them to kick the stallion and depending on where she kicks him, it can be a career-ending injury for him. Definitely your risk of sexually transmitted diseases is increased. And there's just less control. So you don't necessarily know when the mare ovulated. Um, so timing can be a little trickier at that point. And then two, especially if you're not doing anything with the mare, you just kind of turn her out with him for a while. Did she get fluid after she was bred as to know like, well, why didn't she get pregnant? That's harder to know as well. Then you've got in-hand breeding, which is more controlled. You bring the stallion together, and most of it's done with someone holding the mare and someone holding the stallion. So you do have more control over everything, over the timing. So you can, like we talked about earlier, kind of manipulate her cycle, give her an induction agent, go and take her to be bred, check her afterwards kind of thing. This does also increase potentially the number of mares that a stallion can cover at one time. Definitely a little bit more, or definitely more risk to the handlers, especially depending on, the behavior and training that has gone into for the stallion and the mare. Um, and two, I think sometimes this can lead to some behavior issues, especially with the stallion. Um, so definitely, need to be very careful. Um, it definitely takes more personnel, um, and you still have your risks of injury to the stallion, the mare, as well as, still transmitting diseases.
So Olga said, we have a very good tease mare who is 16 years old. She is not ovariectomized.
Oh, wow.
We are curious how much longer she could be a successful tease mare as she ages. At what age would a mare be no longer interesting to a stallion? Or would we be able to add injectable medications to keep her working as a tease mare once she is no longer cycling very well?
Um, yeah, so it's like tease mares are, you know, what was the first part? Like
She
she's,
does not have she still has her ovaries, I guess
yeah,
that's what she's saying. Um,
and then
she's 16 years old.
I mean, you probably are, I mean, that's hard to say. Truthfully though, I mean, I've, again, I'm not looking at these older mares for breeding. So, but I will say, I look at a lot of mid 20-year-old mares, like even breeding. Like I've bred a lot that are in their early 20s that owners are still trying to breed, or we're still trying to flush embryos off of. Um, I mean, I've only had one that someone was trying to breed who she was completely anovulatory, no longer, but even like colics and stuff, I still feel some of these older mares, they still ovulate. So, um, at 16, I think you have quite a bit longer for this mare to still be showing signs, and definitely yes. Um, you might find as they age, the window when they're most receptive tends to shorten a little bit. So, early March, even early April, you might notice, hey, she's not showing signs of being in heat quite like she used to. But definitely you can use hormones to help with that. Um, so, I would think you still have quite, at least another 4 years, if not even a little bit longer than that with her.
Mm.
Um, yeah.
That's good to hear.
I'm trying to think. Yeah, I mean, um, like I said, you got to think a lot of those embryo transfer mares are usually these, early 20s mares, and they're definitely all still cycling. I mean, I even had a mare when I was an intern. I think she was 27. She had a foal on her side, and we were breeding her. So, um, truthfully, I would say most horses probably pass away before they quit cycling.
Mm.
That probably is changing a little bit now that they're living longer. But easily until they're, early to mid 20s, they're still cycling, most of them. Um,
Yeah, that sounds really good. This mare was on a breeding lease with us, and the owner's considering selling her to us. And with her being older, I'm trying to see, how many years we're gonna get
yeah,
from her because she's such a, submissive mare to the boys, so she doesn't necessarily have to be in heat to kind of show signs enough for us to collect. And that's what I'd like for her to continue doing for us,
yeah,
so we don't have to have a rectomized mare here to support collections.
yeah, no, definitely. Yeah, that is really nice. Um, Even for live cover, if you're still doing ultrasounds, kind of trying to time it correctly, you're still looking around, I think that's a good average of $200 plus for that, depending on the mare. And then if you are hauling, and then potentially too any kind of mare care fees. So for live cover, easily, 200 per cycle. And just remember, like, truthfully, with any of these types of breeding, I always kind of tell owners on average, like average of three to plan for 3 cycles. If the mare gets pregnant in less, hey, great, you won the lottery. But, be prepared for that. And if that's not realistic and, not an option or, something you struggle with, then you might need to rethink, trying to breed your mare. I think that's the big thing too. I get, unfortunately, a lot of clients lately who, want to come in and breed her one time and expect a pregnancy, and realistically, it doesn't happen in one time. So I just always want everyone to kind of know up front kind of what you're getting yourself into, that it can take a lot more. Going off of the live cover, then we've got artificial insemination, which I think is, across the board how most horses are probably being bred these days. And then you've got your fresh semen, your cooled shipped, and your frozen. So the fresh semen, either the mare is on site with the stallion, collect him, and then you split your doses up. The nice thing with that is you get the semen is fresh, so definitely higher fertility rates typically with fresh semen. Um, but again, you can collect the stallion and breed multiple mares that same day. Similar with the chilled and cooled. Again, you're going to collect the stallion. You can then ship the dose, breed multiple mares with that one collection. The nice thing is then you're getting access to genetics that, otherwise you may not be able to with this. Your mare doesn't have to go anywhere. Your mare gets to stay at home where she's happy and probably the most relaxed. But timing is very important when you're talking about the chilled, cooled semen. And that's usually then we're using those induction agents. You know, uh, the timing of ovulation to when the semen's put in is very important. Um, some stallion, this too is when you start getting into a little bit of like stallion fertility. Um, so some do better, um, and that can affect your pregnancy rates a little bit. And then you have your frozen semen, which definitely they're better than they used to be. And again, can really open up, the pool of stallions and genetics that you're using. But it definitely is going to increase your costs quite a bit. And that's just because on the veterinary side of management, we're checking these mares a lot more frequently. It takes, the nitrogen tanks, we're checking those. So it takes a lot more equipment, and management. And again, some stallions freeze really, really well, and have good post-thaw motility, and some have really, really poor, motility. And the other thing too is while motility is an important thing we're looking at, it's also the fertility. Some stallions are, and again, this is getting into our stallion talk just a little bit, but some do better as frozen and some do better as chilled. So that history and kind of those pregnancy rates, that owners would be giving you are helpful to know, kind of help push you, well, which one should I use? Frozen semen can also be a little more irritating, to the uterus itself. So also something to think about if you have a mare that has some post-breeding endometritis issues. Frozen isn't always a great option for those, but just something to kind of work with. And again, as a kind of vet breeding that mare, I'm going to do things a little differently if I know she tends to get fluid. And then you've got a couple of different ways that we can do the artificial insemination. So you got the standard AI, and this is, we just pass the catheter, through the cervix into the uterus, and then just deposit the semen right there. You have deep horn, and this is typically something we'll use for either frozen, or like a low volume of semen. That catheter is passed further up into the horn. So, at that point, I want to know which, ovary is she ovulating on. I'm going to pass, the catheter up that horn and then get as close as to that oviduct as possible to maximize the chance that fertilization is going to happen. And then you have the hysteroscopic insemination, which in really, rare, but when you have really low sperm counts, you can use the camera, and then place that semen directly into the oviduct, as well. Again, kind of with each one, a little bit more equipment, a little bit more experience. So of course your costs kind of go up with each one. Definitely the big benefits with artificial insemination. There's really no risk of injury, and definitely a substantially decreased risk of any kind of transmitted diseases, versus with any kind of natural. And then biggest is that, again, just opens that pool up for genetics. So you can get stallions anywhere in the world, and have that shipped over. The disadvantages, the timing, relative to ovulation needs to be pretty precise. So again, we're ultrasounding more frequently, we're using drugs. You're talking increased costs because again, the veterinary knowledge, the specialized equipment. Biggest issue we've been having, I think, the past few years then too comes into is with the shipping delays, or any kind of issues with collection. And that's hard because those are things that can't, unfortunately, you can't really do anything about. You know, um, and the hard part too, I think, is that sometimes mare owners, unfortunately, have to just eat some of those costs. we've had issues where the semen's gotten lost or, it sat on the truck over the weekend because for whatever reason they didn't deliver it. Um, and that's frustrating because now you've missed a whole cycle, but unfortunately, those are some disadvantages these days that we're facing a little bit more frequently than we used to. So definitely your best chance of getting a pregnancy, your highest rates um, come with fresh semen. And even if that's AI'd fresh semen, your fresh cooled typically is around 66 on average percent chance. And then frozen drops down to about 50% per cycle. So again, um, something to kind of think about. And again, you'll have variations depending on the stallion and his previous pregnancy rates.
Okay, so this is from Rebecca Courtney. Select Breeders has been sharing a timed insemination protocol for frozen semen,
Hmm.
using 2 doses a set time apart. Do you have any idea of how the success of this protocol compares to cooled semen or traditional post-ovulation breeding with 1 dose of frozen? Would the cost of a second dose negate any benefits?
Sometimes, I think mostly it comes down to the cost. You know, and again, I think it depends on the stallion and how much is available. Um, the 2 dose protocol does tend to increase your rates just a little bit. Um, but I think a lot of it then also you gotta like I think a lot of it is to what how you decide, do we use just the one post ovulation or do we use both? Um, really comes down to the cost of the dose as well as the quantity available. Sometimes, say the stallion's dead and you only have whatever's frozen, that's all you have. Um, yeah, that really just kind of comes down to a little bit of kind of the mare, um,
So,
and kind of
sharing the timed insemination protocol of the semen using 2 doses at a set time apart, so frozen semen, assuming that the stallion is still alive and viable. Do you have any idea of how successful of this protocol for frozen semen using 2 doses at a set time apart? Um, have you had any success like with using a
with
2 dose
using
before?
both. Um, yes. I mean, I feel like at the end of the day, I probably have done more that we just did the um, post ovulation breeding, and we didn't do the pre. And truthfully, that came down to um, the owners kind of wanting to, save that dose for either another mare or kind of another try. Um, I think that kind of just goes back to having a talk with your vet, and I don't think it dramatically increases your pregnancy rates doing a pre and a post. Um, so, kind of going back again to, well, what are those stallions? What are his pregnancy rates? Um,
Mm.
and then kind of having that talk, um, with your vet who's doing it and deciding, is it worth, which one do you do? I would use it kind of on a case by case basis. Um,
So Olga had a shipping question, which at what point would you consider the semen no longer usable with the shipping delays? Yeah, I'm gonna let you answer that first part first.
that's again, it just depends, I had I look at the semen, and even if it looks absolutely terrible, you know, I will say I kind of leave it up to the owner a little bit. I had one I had one shipment a few years ago. The semen got caught up. It was a really hot weekend. I think it was like 4th of July or something. It was a long weekend. When we got the semen, it looked terrible. I would have said less than 10% of them were moving. The owner, this was the last chance for this mare. So she said, put it in. And I said, okay. And, lo and behold, we got a pregnancy. Whereas I would have, I was inclined to tell her not to try. But, um, again, that depends on the stallion. You'll have some of these stallions that'll last, they can last in extender for even 4 and 5 days. So,
There's a second part of this question. If the motility is still adequate, how do you assess the fertilizing capacity if the package was lost or delayed?
um,
When I'm asking the question, I guess my thoughts are, sometimes we get a package that's lost and folks are, asking, do we use it? Do we not use it? What's the best for, mare owners trying to make the decision? But by the time they get it, it could be no longer cool, right? The ice
yep,
packs could already be warm.
yep,
And obviously, if you're shipping with antibiotics, there's some protection, but
yeah.
is it still usable, or do you just say, if the ice packs are warm, toss it out? It's not a good idea for the mare, or do we not worry about the fact that it's no longer chilled?
Um, I think the chilled part, that's most important as far as really for, keeping the sperm alive, and kind of longevity of the sperm. Um, More so than I don't know that I really at that point worry about any kind of like antibiotic, like that aspect of it. Um, Again, I think that's a discussion of it's just an individual case by case. If there are even a few moving around, the mare hasn't ovulated yet, or she, just ovulated, so you're still within that, the timing is still right. Do you go ahead and try it and see? And again, I think that um kind of as a case by case basis. Say the timing's not right, then no, there's no point in putting that in there. Um, but if the timing, like I said, if she hasn't ovulated and the motility, there still are some viable semen there, it may be worth it. Even if the semen is warm.
So Olga had another follow-up. We breed full drafts and light horse crosses and notice a difference in the conception rates. The mare prep and the close cycle monitoring certainly plays the biggest role in the success of conception. But it seems like the breed of the mare is also a factor, with
Mhm.
the light horses settling slightly easier than the drafts. Could you comment on the draft horse versus the light horse fertility?
Yeah, I mean, I think definitely, again, kind of generally speaking, I agree. I think draft horses are a little bit harder to get pregnant. Um, and I think some of that is just, the kind of long-term effects of, what they've been selected for. That being said, they're the stallion, looking at the stallion side, like they're the stallion motility, the stallion concentration levels aren't nearly as high, generally speaking, in draft stallions versus, like some of these Arab stallions have just millions, and you can get so much more semen from them because they're so much more highly concentrated. Um, and again, I think that just kind of goes back to the genetics, um, and that in selecting for some of these qualities that we're looking for that are inherently part of what makes them that breed, you get some of those poorer quality semen. Same thing for the mares, some of them, again, especially these days, we see a lot of overweight mares, and drafts too, they have much slower metabolisms. I think they're very prone to some metabolic stuff. All of that further decreases their chances, of getting pregnant. Um, so I think a lot of it, yes, is kind of what inherently makes them a draft horse also does slightly decrease their fertility rates for sure. Um, and that's an important factor too when you're looking at um, breeding for, you know, how you select who you're breeding to or kind of what we want to carry on. Just because if you look at like the quarter horse world, like some of these quarter horses are super good at their job, but they have horrible, horrible semen and terrible fertility rates. And so it's a balance of, we also need to be selecting for some of those traits differently. Um, so,
Okay, you can go get your donut. Okay. I know Allison has a question here um, regarding ISCI, and we've got a couple of slides
yeah,
moving forward, so we'll hold
we'll
off
do
on
that.
waiting. We'll wait on engaging that until we get a few more slides in.
Yeah, I think almost there. Um, yeah, so for AI, you're looking kind of expect roughly about 300 um, and up, again, depending on how much kind of monitoring you're doing. Um, I want to say that might even be, um, yeah, upwards of like five too, if you're doing like some post breeding flushing and stuff, that can go up fairly quickly, but um, and then shipped chilled, definitely you're looking quite a bit more, again, more monitoring, the drugs to kind of ensure ovulation, um, and then yeah, any kind of farm calls or boarding. And then frozen, again, you're going to more management, more drugs. So quite a bit more, 600 and plus per cycle. So, and now kind of go into the ICSI question, but we'll get there. So, further alternative breeding techniques. You've got embryo transfer. Um, we also, oh, how do I go back? Oh, sorry.
Sorry. Let's see if we can get
There we
back.
go.
There we go. All right.
Oocyte collection, and then ICSI, IVF, and then I will touch on cloning just briefly. So embryo transfer probably is, definitely a lot of kind of a newer, we do that a lot. And especially in your older mares, a mare that's had some kind of injury she can't carry, a good option. If you have a show mare, you really want to get some pregnancies off of her now, but you want to keep showing her, working her. Embryo transfer is an option. So we breed the mare, the donor mare, and then we're going to flush that embryo from her uterus, and it's then transferred into a recipient mare who then carries it to term. The oocyte collection, OPU, and that's used, they do transvaginal aspiration. You use a needle that aspirates the oocytes, and then typically with IVF, and then that's all done kind of in a lab. So it's all very, again, with all of these, the more you kind of go into them, the more expensive they're going to be, more equipment, more training, experience is all going to go in. And that's reflected in cost for all of these. With the ICSI, the oocytes, again, kind of all in a lab, they're matured. And then it's when they are ready, then you transfer, um, inject the sperm directly into the oocyte and then stays in the lab. And once you get a viable embryo, again, then it's transferred to a donor or I'm sorry, a recipient mare. And then cloning, not done frequently, but it is out there, and it's a somatic cell nuclear transfer. And again, quite complex and involved, but same thing. You're going to take eventually the embryo and transfer it to a recipient mare. So, embryo transfer, definitely the most common one of these. Again, same thing. We're going to remove the embryo from the uterus and implant it directly into the uterus of a recipient mare. Typically, you're going to, breed that donor mare, either AI or deep horn. Again, if you've got very low sperm counts, you can do the hysteroscopic insemination. The benefits is, again, you have a single mare, you can get multiple babies off of her in one breeding season. You can use it for mares that have trouble conceiving or carrying a foal to term. Again, whether that's age related, her uterus just can't support one, or she's older, you don't want to put her through another pregnancy, but really want to carry on her genetics. And you can even freeze those embryos and save them for another time for later. If you get enough, that is an option too. The timing has to be very precise. We want to know exactly when she ovulates, both for knowing when to flush the embryo as well as to, set up the recipient mares. So there's quite a bit involved with this. If you're trying to do this with your own recipient mares, they have their own kind of checklist of things they have to go through to kind of qualify. And the more you have, the better. I have some owners that want to do this and provide their own recipient mares. I feel like truthfully, it's probably more cost effective to ship it to, some of these places that have their own recip herds. Because inevitably, again, the recipient mares, the timing might not be quite right, even if you're doing synchronization protocols. They just don't quite respond, and you definitely need to have a recipient mare that has the timing is right, so that if you get an embryo, you have the best chances of having a viable pregnancy. Again, kind of the disadvantages, the need for a lot of expertise and the equipment involved. Most places offer a package, typically when you start talking about embryo transfer. And I would, yeah, easily start from 3,500. That doesn't include most of them. You have to pay that. And then you pay a separate fee for the recipient mare once they've established, that she has a heartbeat. So that usually I would say is about another 25 or 35 and up, just depending on who you're going through. So the oocyte collection, so OPU, the mare is sedated. She's stimulated so that she produces kind of multiple follicles, and then using transvaginal aspiration, they aspirate the oocytes. This is really nice too. It can be done pretty much all year round. You get you have the potential for multiple oocytes in one cycle, which potentially can produce multiple embryos. So versus doing multiple embryo transfers, you could get kind of the same number potentially. In reality, uh, you'll get a few, you'll get quite a few oocytes, but then how many of them, you know, come into actual viable embryos, it definitely decreases quite a bit. And then again, you can cryopreserve them for, say you want to ship them somewhere else. That is possible too. This can be a little bit painful for mares. There are some small, definitely you're starting to get into increased risks for the mare as well. Um, so that, just understand that. And definitely kind of repeat it if you're doing this multiple times. You definitely can cause some damage to the ovaries. Um, Definitely this is an area that we need to do some more research into, is kind of in stimulating them to produce more follicles. What kind of long-term um, risks or kind of long-term issues are we increasing? Women that go through multiple rounds of IVF are kind of at higher risk for certain types of cancers. So, like I said, that's an area we definitely need more research in. So, and this, definitely just the OPU portion, 500 and plus. I mean, the whole process, is going to be quite a bit more expensive. Um, so. And then with the IVF, so say we've gotten some oocytes, um, most of the time we're using ICSI to then fertilize it. Um, Again, you can get multiple foals per year, um, typically from mares that can't carry. Preserving genetics are definitely some advantages. Um, again, the disadvantages very similar to, embryo transfer. Um, your positive like foaling rates, pregnancy rates um, are quite a bit lower. Um, Definitely all of this is done at a vet clinic and not just any vet clinic, these are vet clinics that have specialized facilities um, where they're housing all of the oocytes and embryos. Definitely Yeah, and there are fewer facilities. There aren't that many. There's only, I think, two or three in this state. So again, much more specialized as to places that offer ICSI and everything. What was this might be a good time for her?
Yeah, so this is actually more stallion directed, which Allison, we will be covering a lot more of the stallion perspective in part two in February, but I'll ask the question anyway. Allison asked if you had any recommendations for a stallion getting more foals on the ground. He's proven sire. He's been checked out, and from what she's been told, he has been ejaculating into his bladder. Recently, he has not been getting any mares in full and was wondering if you had any recommendations for him. Is his only option to geld him or do ICSI? The veterinarian recommended doing ICSI, but said just to get semen evaluated and to breed one mare was going to be upwards of $5,000. She was really hoping maybe this could be resolved without having to do the ISCI to her herd of mares, miniature horses, by the way. He's getting some sperm collected, but from the sounds of it, most of it's going into his bladder.
Okay. Um, yeah, I mean, I guess it's hard to say a little bit with just that. But definitely, I mean, I think I guess I'd go back to like the starting to just look at even his semen and what are you actually getting collected? Like how much is in that collection?
Well, we're going to
I
talk
don't
about
know. Yeah,
the if we
that's
do the late term castration, being able to harvest the semen
yeah,
that's in there and then freezing it. We'll talk about that in the stallion
yeah.
management portion. So um, we'll
I think
we'll try and address that in February if we can come up with some good answers
yeah.
for that.
Yeah, you know, yes, you might have to resort to ICSI for that if what is coming out is so low in volume. Again, you might be able to get away with like a deep horn or the hysteroscopic, um, potentially. Um, those might be options. I think it depends on how much he's actually, yeah, how much y'all are able to actually collect and what it looks like. Um, but. And then kind of roughly for IVF, you know, I would say this might even be on the low side of things, but on average, this is what this study found, is that realistically you're looking, about almost 4,000 for IVF, and that's kind of just that aspect of things. So don't forget you still have your all your kind of pre-evaluation stuff on your mare. Um, Stallion fees, all of that. So, I mean, you start doing IVF, you're getting upwards realistically of like 15,000, 10, 15,000 when you kind of factor in everything. A little bit more on the ICSI. So that's single sperm cell, and that's injected directly into the oocyte. And then that is grown in the petri dish. And then once it results in an embryo, it's then transferred. Um, so again, kind of the advantages, you can get multiple offspring from one mare, or for mares that have any kind of restrictions. Um, again, kind of preserving genetics. So, say you have limited sperm from these stallions. You can um, produce more embryos that way. Definitely, again, mares usually they're sedated for these procedures, and they often need some time off while they're going through all of this. Um, that's kind of
I think they're all like on the low side, just looking at one part of that procedure
yes,
versus the whole
yes,
the whole
definitely,
picture.
yeah.
If it looks low, I think that's probably why it's
Yeah, because
looking at that
there's a
one.
lot they're not including in those estimates.
Mhm.
And then cloning, really, I have to admit, I've never been involved in any cloning. Um, they do a decent amount of it actually in South America with the polo horses, but not very common. But you're creating a genetically identical replica. The interesting thing is often, though, these horses will have different personalities and even different physical characteristics. So, you're not getting the exact same horse. It's just the exact same genetics. Um,
Are we going to cover ET recipient mare selection considerations? We don't have any slides
we
dedicated to
don't,
that, but
but yeah. So I think the big thing with selection is age. You definitely want a mare who's on the younger side. So typically I'm looking for something that's, 6 to 13. Um, ideally they've had a foal before, and not had any issues getting pregnant, having, foaling that foal, or during parturition. Um, is kind of what I'm looking for. And then definitely, you know, negative culture, negative cytology. Um, usually I'll say, I may not biopsy those mares necessarily if everything else looks good. But if for some reason I have a recipient who doesn't carry one to term, she's getting a biopsy. But yeah, I mean, like I said, you and I won't say I have used, especially when I have clients that are, they don't want to use someone else's recipient herd. They want to use their own mares because they have them. So I have used some mares that are on the younger side, 3 or 4. Again, you know, you're just using a mare that potentially is unproven, and I think that's so your risks that are a little bit higher that you just don't know, and that mare's potentially never had a foal before. So you really, if I had my pick, wouldn't choose a maiden as a recipient, but um, wouldn't completely rule her out. If you're getting over 13, usually at that point, kind of want to retire them or not use them. Again, you just start to get into fibrosis, a lot of just kind of issues from being a little bit older, that make them more likely to have issues during the pregnancy. So, um, and something else to think about a little bit is behavior. So if you have a mare who maybe isn't the nicest to handle or, just has certain quirks, the baby does pick up those behaviors, even though it's the recipient mare, just because from, once the foal is born, that baby is going to be with that mare for a few months. And a lot of that behavior, some of that behavior can be learned. So, you know, again, just because the mare has a uterus doesn't necessarily mean she's a great candidate for a recipient mare. Don't forget like I said, the behavior aspect, because that will influence the behavior of your foal. So, does that help answer your question about recipient selection a little bit, or?
Yeah, that's great. Really helpful. Could you comment on the size of the donor versus recipient, the size of the horse?
Yeah, so, interesting. Again, the mare is pretty cool in that they've done all those studies that where they took the thoroughbred babies and they transferred them into pony mares and vice versa, the pony babies into the thoroughbred mares. Um, and so there is some, in theory, the foal is going to grow to the size of the uterus. That being said, no, I'm not going to put a draft baby in a, thoroughbred, or a quarter horse mare. Um, but so yes, if you're talking, especially if you're talking about like embryo transfer on a draft, ideally you're going to really want, um, another draft mare to put that foal in. And again, this is going to, if you're for some reason using a maiden or a younger mare, that consideration, if there's a significant size difference, or hey, this stallion tends to throw really big foals, that is an important consideration to have. I don't like breeding my maiden mares to stallions that are significantly taller than them. Um, you know, again, I think it does increase your risk of potential like dystocia. How much, I think that's hard to say, but I try and do my mares to my recipient mares to roughly the same size or to something bigger. Um, so